So I'm Salman Keshavji, and I'm here to tell you about Gen Ed 1093, Who Lives, Who Dies, Reimagining Global Health, which I co-teach with Jason Silverstein, Marty Zeev, and Luke Messick. So the urgent problem that we're trying to address in this course is that we're trying to figure out why and how health and healthcare delivery is so unevenly distributed within communities here in the United States and in the rest of the world, the rest of the globe, which is why it's Reimagining Global Health, of which the United States is part. Unfortunately, the fight to deliver healthcare to people who need it, especially to people who need it the most, has been plagued by failures. And one of our colleagues who used to teach this course, the late Professor Paul Farmer, he used to say that these failures are myriad. And he said that they were failures because we are chronically short of resources, failures because we're too often at the mercy of those with the power and the money to decide the fates of hundreds of millions, failure because ill health, as we've learned again and again, is more often a symptom of power and violence and inequality. And he kind of set as a goal, as we're rethinking about healthcare delivery, he said we want to fashion our world into one where no one starves, drinks impure water, lives in the fear of the powerful and the violent, or dies ill and unattended. And that's really utopic. And in this course, we're not attempting to go to a utopia, but as we're moving more and more into a dystopia, I think we can all realize that our goal is to move towards something better and more humane. And that's what we're trying to do in this course. So in Who Lives, Who Dies, we do this by focusing on healthcare and healthcare giving, care delivery as a biosocial phenomenon. So what does that mean? So if you're sick or hurt, whether you live or die depends not only on biological factors, but social factors. Who you are, where you are, what sort of health system is available to you to help you survive, what type of care is available to help you recover if society believes that you deserve it. And so this is not a course that focuses on the biological basis of disease. Our aim is to take a novel approach to reveal how governments, institutions, and histories shape health and well-being, how poverty and racism manifest themselves in people's lymph nodes, or how cost-saving measures, though well-meaning, may actually result in people getting things like TB. And we want to challenge in this course conventional assumptions within the field of global health, that a lot of this is just biological, and try and provide a lens through which we can understand why and how historically persistent health inequalities, structural and institutional policies, equitable healthcare, and caregiving has been so uneven. So that's our goal in this course. And so in the course, we will rely on the methodologies of anthropology and history, coupled with an understanding of medicine and epidemiology, to unpack the reasons why health has been delivered so unequitably. So we'll start by exposing students to a global health toolkit. It's kind of like a theoretical or intellectual tools that help us re-socialize our understanding of healthcare. Dr. Kirby has set the standard now. We'll talk about ways to understand disease that aren't only biological, but understand that that disease exists within a web of social relations. And we're going to basically, it's going to be a broad stroke. We're going to look from the 19th century to the present to see how the working class in America and communities in other parts of the world tried to get healthcare. And we'll look at the ideological framings of these problems and then think about new moral reorientations that can offer us the possibility of changing the system. So students who have taken this course says that it transforms their lives. And that makes us as teachers feel really good. Now, that's a biased sample. It's the ones that tell us that. But they say it transforms their lives. Not only their transforming of health and health delivery, but also the world that we live in. So we're really excited about teaching the course. And when we teach it, it actually transforms our lives as well. So I'm looking forward to having as many of you and people who are not in this room at the course. Thank you.